My name is Bob Shapiro. I'm a practicing board-certified neurologist. I am a professor of neurological sciences at the University of Vermont in Burlington, Vermont. The perception of migraine has been enveloped by a sense that it's immediately and inevitably and inextricably tied to headache. We talk about migraine headache. And headache itself is a word that actually has a couple of different meanings. There are two different definitions for migraine. One is head pain related to migraine or other types of physical problems in the brain. And the other actually is annoyance. And in terms of the weighting in common usage or in the media currently, it's about twice as likely to be used as a metaphor of devaluation or annoyance than it is actually as a physical problem. So migraine itself ends up being tied to this sense that this is not something that's serious, not something that is really worthy of concern, and that people who have it, maybe it's really a character flaw of inability to cope with what everybody else experiences when they talk about headache as a mild, self-limited condition, which over-the-counter medications take care of. Compounding that is that there really is a gender difference. Whether or not that really makes a big difference is a matter of some debate and dispute, but there's no question that 3/4 of people with migraine are women, and that has its own potential impacts as well. So people with migraine must contend with this big barrier about whether or not their condition is important or serious, and consequently whether or not it's valid and reasonable for them to acknowledge that they have this condition which can lead to impairment and disability. And this has particular impacts on the job. If you have a condition which your employer doesn't take seriously, then you're pretty reluctant to say that this is a reason why you can't work effectively. People with migraine don't necessarily desire to work at diminished capacity, kind of silently hidden, but if the alternative is to lose their employment, they have no option, they have no alternative. So as a consequence, migraine is a condition which necessitates, it requires, it's actually a part of the disease to have it be hidden. In fact, the experience of migraine, a migraine attack, is an experience of withdrawal from social interactions. So people avoid bright lights and loud noises and social interactions and conversations, and they just want to disappear and remain motionless. And that's completely in alignment with the idea that being hidden is the necessary strategy for being successful. What we've been working on, what we've been trying to make change and affect change for the last decade or so, is to try to identify where those attitudes, those stigmatizing attitudes towards people with migraine, have wound their way into public policy. So we call this, the term for this is called structural stigma, where there are disadvantages or discriminatory practices on the part of public agencies or corporations or areas where it's clear that people are disadvantaged for having this condition relative to somebody else who has a different type of a disabling condition. So the NIH in 2015 funded $20 million worth of research related to migraine. And if you look at how the World Health Organization, through the Global Burden of Disease study, measures the burden of individual diseases, there's a particular measurement tool they use. Migraine actually has as much burden as a number of other major diseases most people don't think of in the same category, such as breast cancer or arthritis or digestive diseases. So we are interested in trying to change NIH funding. In terms of the actual disability issue, it comes up all over the place. So if you're injured on the job and as a consequence of a head injury or concussion, you find that you're completely unable to work, that you're fully disabled as a consequence of this, which is not an uncommon problem for people who have episodic or infrequent migraine attacks, that their migraine can progress to become every day. There are 100,000 veterans of the Iraq and Afghanistan wars who have headache disorders, most of which conform to migraine more than 15 days per month as a consequence of their exposure to blast or concussion injuries. So this is really a common problem. And if you have this sort of an injury on the job and you apply for workers' compensation, and it clearly is a situation where no one really can adequately dispute that it occurred as a consequence of your employment, and you win your case for workers' compensation, you will be awarded only 5% of a whole person impairment for actually being fully disabled, because migraine isn't considered a potentially worthy reason to actually be fully disabled. And if you go on to apply for Social Security disability insurance because you can't work, and you've been working for 20 years, and yet you've put in the amount of money into the Social Security system, and you're looking for the insurance that is what the program is intended to do, and you apply for Social Security disability insurance, you find that an essential step in that process is that you need to meet the impairment criteria for your disease that's listed in a particular document. And what you find is that migraine isn't listed in that document, and that you have to compare your impairments to something which is not the same, like epilepsy, in order to try to make your case. And this is despite the fact that migraine is the second leading cause of all global disability. They need to own the fact that this is a condition which they have. And since a part of it is genetically predisposed, you inherit some susceptibility to this, part of it's due to other factors, environmental factors or the like, this is something which people with migraine will always have some susceptibility to have. And it doesn't mean it's not treatable, it doesn't mean that there aren't things that can be done to reduce the likelihood it shows itself, but it doesn't actually help people with migraine to remain hidden. It helps to promote the idea that this is a condition which few people have, and the people who have it are unreliable, which they aren't. But if people consistently don't disclose the fact that at times they may have difficulty with tasks because of it, then employers interpret their change in work habits as being that they're not as reliable employees because of that's who they are rather than that's part of their condition. So it's the hardest thing for patients to actually identify themselves as having this problem. But it's probably the most important and necessary piece to actually move beyond the stigma. The investigations, the studies that have looked at what is the most helpful or successful strategies to mitigate stigma for, say, HIV or mental health conditions, indicate that among the most powerful ways to mitigate this is having contact strategies. That is, people who have the condition, which is being stigmatized, having contact with the people who carry the stigmatizing attitudes to undo that, to reduce the myths and reduce the idea that there's something different about these people that makes them lesser, makes them devalued. Groups emerge and take leadership roles as patient groups. This is not something which is a top-down from medical professionals, but rather a bottom-up from patient groups to identify that this is an area that they need to speak for themselves, that they have insights and an appreciation for the problem which medical professionals like me could never have. And so this is a very hard thing to advocate for patients to do, because it might come with apparent penalties. Okay, they may have to confront their employer, and this is asking people to take risks. And what we're hopeful is that if we're successful in reducing or mitigating some of the structural stigma issues, bringing these forward in a public way, in public policy ways, that may provide additional space for people who have migraine to say, yes, this is a problem for me too, and I need to have that be recognized so that it's not something that I'm carrying silently.